Could you just tell us, over changing global health developmental discourse, how you relate the journey of emerging global program as of now?
Well, each time it is related to such a conference which has a theme, and we really link the discussions we have with the global themes. So this year it is on the resilience and the responsiveness of health systems. 2 years ago it was on patient-centered healthcare. So we discussed quite a bit on universal health coverage, which is now the overarching goal for health in the SDGs. 6 years ago, for instance, it was much more on out-of-pocket expenditure and catastrophic health expenditure, which came down very high on the agenda. And you see that now it has been mainstream. Many people speak about that. So we try to link the work of the young researchers to the topics that are now mostly on the agenda, because it's important that if they engage in these conferences, that they are quite up to date with the latest thinking and the latest research.
I'm just trying to think, how different this program is from a conventional capacity building program. So if you can reflect a bit on that, then that can be very much useful for the emerging health researchers.
So I think it is relatively unique in the sense that it is really very international. We are not really connected to one or other country, so it's really very international, but we select people, as I said, that who are quite well connected to their own context, bring them together and foster this exchange between people from various contexts, but then immediately give them the opportunity to be in such a very prestigious conference and see what is the diversity also then in the global health scene. There are people who have quite different opinions and so on, and to really engage with these different opinions. I think most other programs, they are led by one particular school of public health or one particular university, which has a certain view on things, and they try to train people within this paradigm or within their dominant concepts, but from the onset we expose them to this big variety, and I think that is quite unique.
What you want to tell the emerging researchers or health system researchers who want to build career in that particular context to this program?
Well, one specific to the emerging voices, this year the whole program has been organized by EVs of the previous promotions. I was there, but I must say my role was quite minor. I've very much enjoyed it, but you see that quite a number of the emerging voices, they developed and also that desire to share insight, to coach more junior researchers, and to create a kind of movement where they are very connected to people across countries. I think we are now at a stage where EV, that has been essentially been a training program, that we have more than 200 emerging voices already. I think more than 100 are very active in the network, that there are also opportunities now to do more research, cross-country comparative research between a number of countries with these young and enthusiastic people. And many have obtained PhDs now. They have really grown in their career, and I think that would be a fantastic future. To still continue, of course, with the training and to broaden the network, but also to develop more research. We have seen also that there are a number of similar but different initiatives. What is extremely important, and that's one of the main messages I do, the intention is not to become part of the kind of global bubble but they remain very well rooted in
Local context.
local realities, and to feed then the global conversation. But the objective is not just to be in that global stratosphere, but really to have as an overarching objective still to introduce local changes, local improvements for the most needed.